My name is Michael Kasparek. I'm working in Speising in the orthopedic hospital in Vienna. Speising is the biggest hospital in Austria.
Dr. Kasparek begins by taking an X-ray of the knee. He then plans the procedure, determining implant sizes, resection height, and alignment of the cuts before going into the OR. He usually begins with local infiltration anesthesia before making the skin incision. He uses a mid-vastus approach, followed by shifting the patella laterally. Immediately after shifting the patella, he places the femur alignment guide on the distal femur to position 2 Schanz pins for the cutting block fixation. With the 2 pins inserted, he first affixes the cutting block base, which features an interface for the bone reference array. No additional pins are needed. He then inserts the adjustment unit and the cutting slot. With knee 3, he now navigates varus, valgus, flexion, extension, and resection height by fine-tuning the adjustment screws of the fine adjustable cutting block.
I like the fine adjustment because if I have the cutting block fixed approximately where I want it to have, I think it's much more easier to correct it with the screws, better than just with hand.
After resecting the distal femur, he verifies the cut. On screen, the software shows if the cut was done accurately.
It's a perfect option to control what you have done and if you have some failures in your cuts or some major failures.
He then proceeds to the proximal tibial resection by positioning the cutting block using a conventional extramedullary alignment guide. After a quick registration, he verifies the position before resecting the tibia. The software displays the current varus valgus alignment and posterior slope. If the desired alignment is achieved, he fixes the cutting block and performs the resection. The possibility to verify the distal femur and tibia cuts give Dr. Kasparek a sense of security. At this point in the procedure, there is still the opportunity to make necessary corrections.
We have a surgical time from about 60 minutes each knee, from skin to skin. I prefer the knee 3 Express navigation because it's easy to use, it's reproducible, we have in documentation, we have no extra articular trauma, we can do it really fast, and at least it's much cheaper than any PSI cutting block or cutting guide.